Hi everyone, I am Dr. Ruby Rose. I am a double board certified integrative and functional medicine physician here at Snyder Plastic Surgery and Wellness.
And I'm Marisol Norwood. I am a licensed medical aesthetician.
Yes, and we're here to talk to you about hormones, gut, and skin. So, question for you, Marisol.
Yes.
What is your take on skin and how important it is as a reflection of the body?
Skin is your largest organ in the body, so we want to protect it by doing all kinds of treatments at home and in clinic procedures or treatments. We want to make sure that the skin barrier is nice and healthy. You have great circulation, improving fine lines and wrinkles, hydration, all the things.
That sounds amazing. I love that. Yeah, I think it's so important that we take care of our skin because it is such a reflection of our body inside. You know, when I look at people's skin, it tells me a little bit about what's going on in their gut, particularly. So, if they come out and they have, the poor color of their skin, or if they've got acne, or if they've got, certain types of rashes, I start thinking, okay, what's going on in the body? Mm-hmm. What is your take on that?
Looking at melasma, hyperpigmentation, skin sensitivity, women who have like facial hair on their lower jawline kind of tells me there's some kind of hormonal imbalance.
Absolutely.
Inside.
Yes, for sure. Awesome. What are some important things that you typically tell your patients, or just about every patient that you recommend to them that they should be doing?
A good at-home skincare regimen. That's where everything starts for sure.
Mm-hmm.
A good cleanser, antioxidant serum, moisturizer, going outside a little bit. It's good for the soul, good for the skin, 100%. Especially while it's protected with sunscreen.
Yes, vitamin D. Yes, vitamin D is super important, and it's very hard for some people to get their vitamin D levels up. It is one of the most common, micronutrient deficiencies that I see in patients. So I always tell people, okay, how do you get your vitamin D level up? And we'll have a specific, talk about this, about getting your vitamin D levels up. But I definitely tell patients, get out in the sun, but you don't want to necessarily go out in the sun full face in the sun and cause some of the sun damage. So some of the things you can do is just get out in the sun for like 15 minutes at arms and legs, right?
Increase your water intake as well.
Water, yes, 100%. Hydration is huge.
Big thing, big factor.
Mm-hmm. So yeah, those sound like really important, helpful tips. The skin is such a reflection of your internal environment, and a lot of the patients that we see every day ask us all of these questions about how to make their skin look beautiful, but then they also have all these other symptoms that are coming up that is really a reflection of maybe why their skin isn't feeling great. So, we put this series together so that we can get some of the answers out there, and please let us know if you have questions or any topics you want us to cover, because this is super fun. I'm learning a lot from Marisol, and we'd love to get this information out to you. So thanks for joining us today. If you have any topics you'd like us to cover, please write them in the comments below, and thanks for joining us.
Bye, y'all.